warahmatullahi wabarakatuh. My name is Intan Nia Syesya. I am from class 2B Accounting with team 1120082000068. I will present a video with the theme Covid-19. Please pay attention and listen carefully to this video.
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named Covid-19. Covid-19 spread within China and to the rest of the world on 30 January 2020. The World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a look what is currently known about COVID-19. So, what is a coronavirus? Coronaviruses are a large group of viruses that consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus first identified in China 2003. The Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, SARS-CoV-2. The name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. How the disease spread? The disease can spread from person to person through droplets when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms from very mild to severe. Some people may not develop symptoms common. Symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems such as a chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How to prevent the coronavirus? 1. Applying physical distance. 2. Use a mask when doing activities in public places or crowds. 3. Wash your hands with water or soap or hand sanitizer that contains at least 60% alcohol, especially after doing activities outside or in public places. 4. Don't touch your eyes, mouth, and nose before you wash your hands. 5. Eating nutritious food, exercising, getting enough rest, and preventing stress. 6. Contact with sufferers of COVID-19, people who are suspected of being positive for the coronavirus, or people who are sick with fever, cough, or runny nose. 7. Cover mouth and nose with a tissue when coughing or sneezing. Then throw the tissue in the trash. 8. Keep clean objects that are often touched and the clean lines of the environment, including clean lines of the house.
Thanks for watching, and I hope that with the current situation, everyone can carry out existing health protocols so that we can avoid this coronavirus and return to normal life. Wassalamualaikum warahmatullahi wabarakatuh.